March is National Athletic Training Month. The goal is to spread awareness about the work that athletic trainers do. And you may think you know what that is, but the certified athletic trainers that work at our CU Medicine, orthopedics, and sports medicine clinics play a big role in a patient's care. So first, to describe how what you do differs from what a traditional athletic setting might be.
We actually get to have our own kind of provider care with these patients as we see them day 1 and day 14 post-operatively, as we help with dressing changes, brace fitting, sling fitting, as well as go over surgery photos and everything that was performed, as much detail as they need to make sure they understand everything that just happened.
If someone comes to the clinic, they're likely having a surgery, and then that's when you would assist with their care?
Absolutely. So a patient will come and see Dr. Meyer. If it deems to be a surgically needed incident that is either of the knee and shoulder with Dr. Meyer, I'll go over and help them get physical therapy figured out, get them to understand kind of what's going to happen prior to surgery. Hey, we're going to need you to be ready these certain days. And then right after their care, that 24 hours after, they're going to see me for a 30 to an hour meeting where we go over everything that happened and make sure they truly understand everything and just feel comfortable with their care going forward. Because these rehab processes can be 6 months to 12 months. So just kind of helping them start that process earlier, right after their surgery, can really help with that recovery process.
Having an athletic trainer like Eric involved, he becomes a little bit more the leader of the team because he's kind of the frontline person for all the communication between the team members. And so again, he knows the injury, he knows the patient, he knows the rehab. And so we can tailor that to make sure we're getting patients back safely to whatever sports or activity they love. In a timely manner, but also in a safe manner. And I think that's a huge component of it. And so the value of having him involved in that whole kind of team approach is huge.
To give a patient an idea of what they can kind of expect when they meet you, what does a typical day look like for you?
A typical day, it depends on, so we have clinics 2 to 3 days a week, where most of the time I'm helping get patients in, help them get with Dr. Meyer as kind of as smoothly as we can, and as well as depending on if it is surgical or if it's just they need to do physical therapy, that's where our experience will differ. So if a surgical patient, I'm going to help them a lot more in kind of getting them to understand the next steps and the things that will happen pre and post operatively. And then on the days that Dr. Meyer's in surgery, I'm going to actually see those people that have had surgery back for their 2-week appointment, take sutures out if we need to, and then help them with kind of their care and getting back to kind of activities, kind of lifting or different things that they can do on a modified manner.
He also is so knowledgeable, and this is all athletic trainers, and kind of what patients need to do in an exercise realm and kind of a return to sport realm to get them back safely. And then in the long term, he also gets to discuss kind of how to prevent re-injury. And I think the prevention side of that is huge, that the athletic trainers have that value.
It is nice for me having that background where I worked athletics for years and say, these are a couple exercises I want you to start right away. I want you to do a couple times a day, just things that really can help with pain management, decrease swelling, and hopefully, depending on the protocols, help get some range of motion a little earlier, which can help with everything as well.
And so for a patient to be able to come in and speak to an athletic trainer who has all that knowledge about, again, return to sport, preventing re-injury, and then obviously kind of preventional things along the line is a huge thing. And so I think it's added so much value to our clinics having an athletic trainer like Eric involved.